I'm Jared. You all should know me by now. My presentation today is on Osteogenesis Imperfecta. So the objectives of this presentation is to define this, tell y'all all about it, to identify the pathomechanics of this disorder, to determine the appropriate tests and measures, and to discuss interventions, plan of care, and outcomes. So what is osteogenesis imperfecta? So this is described as brittle bone disease. So this is a genetic disorder involving either too little collagen or production of abnormal collagen. So there's 19 types. Types 1 through 4 is the most common. So type 1 is the mildest and most common type. This is few fractures and deformities with this type. Type 2 is the most severe. Unfortunately, babies usually die within weeks of birth with this one. Type 3 is the most severe in babies who do not die as newborns. So this one is also abnormal collagen production, normal amount of collagen, but abnormal collagen is produced. And then you got type 4, so this is mild to severe symptoms, and sometimes this one is not diagnosed at birth. All right, so y'all go to that next slide right there, got a couple pictures. So on the right there, that patient has type 3, and then on the left side right there, there's a common acronym for diagnosis. It's called BITE, so bones, eye, teeth, and ear, right there. So, bones, there's multiple fractures with this disorder. Eyes, there's blue sclerae, which is the white of your eyes. So this also found too, it can be either blue or gray with these patients. So teeth, you got dental imperfections, and then ear, you got hearing loss. This just shows like the variety of patients with this. You get the mild, that guy looks fairly normal right there on the left. And then all the way to severe, you can tell that they got a lot going on right there. So for your pathomechanics, so this is a genetic condition. There's no prevention. It may be inherited from one or both parents. It can be generated from spontaneous gene mutation as well. This defect causes not enough or abnormal collagen, as we mentioned. This is a lifelong condition, so patients with this, they're going to struggle with this their whole life. So it also involves non-trauma related fractures. So clinical manifestations for this. So you got bone deformities, so genivarum or bow-legged. You got scoliosis or other spine deformities. Usually this can be like excess upper thoracic kyphosis. You got a barrel-shaped chest, easily bruised skin, and then blue or gray sclera of the eye, as we mentioned. The functional limitations, so they usually have loose or hypermobile joints, broken bones, muscular weakness, hearing and vision loss, and also softening and discolorization of teeth. Test and measures. So usually when patients get diagnosed with this condition, X-ray, DEXA scan, bone biopsy, lab test, diagnosis is usually at birth or around birth, and also specialist diagnosis is usually utilized. All right, so for our differential diagnosis, there's a lot of competing pathologies. So that you got Paget's disease, cystic fibrosis, achondroplasia, rickets, Marfan syndrome, skeletal dysplasia. That's some of the similar pathology. How to differentiate is just through diagnostic testing, imaging, lab testing, and also just looking at patient and family history. All right, so intervention. So first you got biphosphonate medication for bone shrink. This is usually the hallmark treatment. This is like a medication that helps the patient strengthen their bones and muscles as well. And so you can take that through IV or through oral medication. So it also, this condition may require bracing, splinting, or surgery for bone fractures. The surgery can include metal rods being implemented. Also dental procedures sometimes are necessary, and of course all these patients need PT and OT intervention, and also sometimes assistive technology like you saw earlier, the different wheelchairs and stuff that patients had. And the goal of intervention is just to maximize long-term function and autonomy for our patients with this, and to minimize fractures and pain and enhance the quality of life. So next we get the rehab stages. So we got the maximum protection phase. So the goal for this phase is to protect the fragile bones, to manage pain, and to just begin gentle mobility. So you start right here with patient education. That's teaching the patients and caregivers about this condition. Just teach them about safe handling techniques and fall prevention strategies. Next is passive range and light active range of motion. So you implement these two things and some gentle range of motion exercises just to maintain joint mobility without putting too much stress on bones. Next, you got isometric strengthening. So that's just surrounding all the bones. The muscles surrounding the bones that are fractured and all. Just you try to avoid too much stress. Hold on. Then you got some stuff for pain, analgesics, heat and cryo. You just use some of these modalities for comfort. And then also you can utilize assistive devices. So, sometimes a walker, may be indicated, or wheelchair, or splints, braces, all that kinds of stuff. Just to help aid mobility and provide some stability for the patients. So next you got the moderate protection phase. So this is gradually increasing the mobility and strength while continuing to protect the bones. So you got progressive active range. So this is just, you introduce more active range exercises and stretching, still focusing on safety. Next you got, strengthening exercises. So low resistance strengthening exercises using bands, light weights, stuff like that. Just emphasizing safe form and just gradual progression. Next, you got balance training. So you just implement some balance activities to help enhance stability and reduce fall risk. So that could be like standing on one leg, using balance board, stuff like that. Next, functional activities. So gradual, introduction of stuff that that they will use in their everyday life. So like sit to stand, gait technique, stuff like that. Then lastly, you got education on activity modification. So just providing guidance on how to adapt to activities, to minimize fracture risk, stuff like that. All right, so last one we got is the minimum protection phase. So in this one, you just continue to advance the strengthening exercises. You can start adding in some endurance training, probably like some low impact stuff like swimming, cycling, stuff like that. Try not to put like too much stress on bones with your, activity there. So then next thing you got is flexibility training. So you can introduce, regular flexibility and stretching routines to maintain range of motion and prevent stiffness. And lastly, you can get them involved in community stuff, encourage participation in programs or classes that, promote physical activity and just ensuring they're safe while they do this. All right, so outcomes, it's dependent on severity type. The patient will deal with symptoms for life. So the focus is on symptom management, protecting patients' fragile bones, enhancing mobility and strength, promoting, independence, while still minimizing the risk of fractures. Regular evaluations and adaptations to the treatment strategy are essential for most optimal outcomes. All right, so overview. Osteogenesis imperfecta is an inherited bone disorder. It's lifelong dysfunction and varies in severity and has many accompanying or underlying symptoms to go along with it. All right, then I got my resources. And any questions you guys got for me? What's up, T?
Okay, osteogenesis imperfecta is caused by a lack of collagen production.
Yes, so it can be a lack of production or like an abnormal production of collagen, if that makes sense.
Thank you.
Yes.
You say abnormal, you say like overproduction or just the abnormal?
So it's like the number is like normal, but it's just like how do I put it? Like it's like not complete maybe or something like that. Yeah.
All right. Someone read that question for me.
Which of the following is most likely a functional limitation for 11-month-old with OI?
Okay. All right. Now, what's your best answer? Why D? But his slide says hidden vision, broken bone, discoloration of teeth.
Those aren't functional limitations.
Say again.
Those aren't functional limitations. Those are signs and symptoms.
So, all right, discoloration of teeth, what is that? It's a clinical manifestation, but it is a what? Well, I'm gonna say a symptom because it can't be measured objectively. I'm gonna say a symptom. We can see this. Well, you can see it. It's a sign. I'm gonna say sign because you can see it. I'm gonna say sign because you can visually see it. Broken bone. Sign. It can be seen with an X-ray. Hearing. All right. So hearing and vision measurement, right? So now this one can be a little bit tricky because you have to go to ENT doctor, ear, neck, and throat doctor, or audiologist, and you can have an optometrist, so they can measure this. But we as PTs are not going to be doing it. So I would just rule this one out. I would just automatically rule that one out. We're not going to be addressing that. And plus, it's not a functional limitation. Okay, so it can go either way, sign or symptom. It can. That's one that can probably go either way. But all of these are clinical manifestations, right? I'm gonna say CMs. All those are clinical manifestations. Clinical manifestation, you have signs and symptoms. Clinical manifestation are broken down into what they call signs, symptoms. All right. The signs we consider, I'm going to write right here, also objective. All right. Typically for us, this, I'm gonna put a little line right there, right there. Typically for us, these are impairments. That we can measure, right? So what does that mean? So give me something from his functional limitation slide that's actually a sign or impairment. What is it? Muscular weakness. This should never, ever be in functional limitation. Right? Now, what made the person may not be able to do due to the functional weakness, to the muscle weakness? Okay. So inability or difficulty standing. Okay. Now, what's another impairment? What could be another impairment that this person could have with OI? What else could they have with OI? So if they have muscle weakness, guess what else they could have? Decreased range of motion. Because the muscles are weak, they're not able to move the joint throughout the range of motion. So decrease, I'm gonna say active range of motion for now. All right? So decreased range of motion. What functional limitation can that lead to? Give me a specific something. There we go. Inability or difficulty. He said put it on clothes. All right, so decreased muscle weakness, decreased range of motion. What else? So right now, my standing ability is dependent on my muscle strength. My quads, keeping my knee in extension from buckling. Also, my gluteus medius muscles, my gluteus maximus muscle, they're keeping me upright, standing, my trunk muscles. So what So, but what if these muscles that help me maintain extension are weak? Poor posture, right? So posture can be an impairment, right? So I'm just gonna say abnormal posture. What can that result in? Functional limitation.
Which is like hard walk or harder walk, difficulty walking or ambulating.
Okay. So you can say, good, difficulty walking or ambulating. All right, what else could they have? They can have a lot with OI. What else? What do I need to stand up here? Starts with a B.
Balance.
Balance. Posture plays a role with balance. They go hand in hand. Decrease or poor balance. If I have that, I have the inability or difficulty with sitting upright or standing. If I can't do those, I can't walk. What else? Coordination. Poor coordination. Decrease or poor coordination. A lot we do requires coordination. Also referred to as timing and sequencing. What I'm doing right now that requires coordination, timing and sequencing. Writing. Difficulty writing. Any other feeding oneself requires coordination. To take a spoon, put it to your mouth. All right. Take a fork. Brushing your hair requires coordination. Brushing your teeth. What dressing, putting on your clothes. Standing, putting one leg through pants leg. Standing, putting the other one. All of that's coordination, timing, and sequencing. Balance. All of it works together. So all of these, what's another one? Also endurance. So endurance can be an impairment. Decrease, poor, I'm gonna say endurance. All right. So this would be muscles. This would be more so strength. Decreased strength. But you can also have decreased muscle endurance. Okay. All of these are impairments. All these can be measured. Okay. What are some symptoms? We know our hallmark symptom is what? That we know that people normally come to us for. Pain. All right. And we got those different descriptors of pain. What else can be a symptom? Inflammation. I'm gonna couple inflammation with swelling. I'm gonna say swelling / inflammation. Why did I put that on a sign? Yep, you can see it and I can measure it. I can compare from side to side. Main thing people come to us for is pain though. But if you think of any other symptoms, feel free to write them in. So your functional limitations are gonna be things that people cannot functionally do, okay? So you need to notice when your patients come to you complaining about pain, they're gonna come to you about pain most of the time. Most of your patients come to you about pain. These are gonna be the impairments. These impairments are typically what's causing the pain. School of thought. That's a school of thought, which is why we don't chase the pain. We find out about these and we treat these, and then typically this goes down, this pain decreases or is eliminated. But in this condition with a person with OI, these are what we're looking at, functional limitation, okay? And the age we see can vary based on how long the person lives, all right?